You have one good shot at a really great outcome. Apex is two things. It is a procedure, and perhaps more importantly, it's a reframing of the fundamental way to think about natural tissue breast reconstruction from the ground up. The name, Apex, was selected based on the want to communicate something that's reached the pinnacle. Apex is the top. Apex is the achievement of something without compromise. So the name wasn't an accident. I wrote the paper now some 9 years ago, and I put it together in a very specific way for two audiences. The audiences I was writing for were surgeons who were running into difficulties with the DIEP operation, producing a successful result, keeping the incisions in the proper place, keeping the breast soft. And over 20 years of practice, those hurdles were being solved internally. And so I put together a 16-point algorithm for those surgeons to show them where their problems were, where the fundamental issues were with the DIEP as a concept, why it didn't always deliver on its promise, why muscle wasn't always protected, why breasts sometimes were firming up after the surgery. There are fixes for that. And that's all covered in that algorithm. The second audience are the layperson patients who are looking for truth. How do we get there? What are the questions I need to be asking? And so the opening word of that paper that I wrote some 9 years ago is myth busting. And I felt so strongly about this that I paid the publisher to make it accessible for the entire world without buying a subscription to the journal. So anyone can download it at any time. What are some of those things that are solved by the Apex concept? They are the ability to keep incisions in the tummy very low, reliably, all the time, so that the aesthetic of the abdomen meets the measure of what we're trying to do from top to bottom. It also allows us to deliver a breast that stays soft after the surgery. Softness is directly related to the quality of the blood supply in the fat that we're transplanting, so that we're not only protecting all of the muscle structure and its strength, but we're also protecting the nerves that power it. And the Apex concept allows that to happen every single time. When I gave the keys to the surgeons, I didn't do that without some accountability being required of them. And I instructed the patients in the article how to request that accountability. Once the tissue's been collected from the tummy, the nurses in the room come capture a quick snapshot of the dissection field to demonstrate the quality of the work that was done to protect that structure. And if the patient ever has a reason to want to see that as part of their medical record, it'll be there for them. That allows us to assure them that we're serious about what we say when we mean we're going to protect your structure and we're going to work for whatever amount of time it takes to deliver a result that's soft, that's beautiful, and retains your strength. So that's the Apex flap and the Apex concept and who the paper was written for. And so at the end of the day, the goal was to open the chamber of secrets, to show people what they need to know to find a better long-term permanent outcome for themselves. Ordinary is easy. Extraordinary takes more effort. It takes more focus. But extraordinary is where the good things live. And so it's worth whatever amount of extra effort whatever amount of extra inconvenience, whatever amount of extra time, because that permanence is yours. Once you have it, you own it.